Well, it turns out President Clinton's latest medical checkup last week turned up a problem: skin cancer. Mike Gilliam's in the newsroom right now with the latest for you. Mike?
Well, John, it's a form of cancer that strikes upwards of 1.2 million Americans every year. And now those numbers include President Clinton. But fortunately, it's not a cancer that spreads through the body. And the White House is already saying the president no longer has the disease. Just days after President Clinton's final routine medical checkup, the White House announced that the lesion removed from his back last week was cancerous.
The lesion was removed, so while the president, I guess it could be said, had skin cancer, that has been removed and he no longer has it.
Doctors say the president is cancer-free because they removed the lesion, and the risk of reoccurrence from the type of cancer he developed, basal cell carcinoma, is low. That form is the most common type of skin cancer, affecting 1 in 5 Americans. Fair-skinned people with lots of unprotected exposure to the sun are hardest hit. And more cases involve younger people, like 30-year-old Bob Spass, who's developed 14 lesions over the last 13 years.
At first, it was quite depressing because you hear you have cancer. But what I soon found out and realized was that this was not the typical form of cancer that is dangerous, that fortunately it can be removed very quickly.
Dr. Kling has treated Spass and many other patients. He says most cases aren't too serious and start with a sore that won't heal, but that those sores need to be treated.
They usually stay local, they can ulcerate, you do need to treat them. I mean, if you let one of these things go long enough, they can eat right through your nose if you give it enough time.
Kling says the cancer can be treated in a number of ways.
The main ways of treating it are by burning the lesion off, by freezing it off, or by surgically completely removing the lesion and sewing it back up.
Patients say the lesions and the treatments are basically painless, but that they're forced to change their approach to handling the sun.
Just have to protect myself a lot more with lotion and sit in the sun for 4 or 5 hours at a time.
So there are some precautions that you can take to avoid skin cancers. Limit the exposure to sun. Use a powerful sunscreen of 15 to 30 SPF and apply it a half hour before you go out so that it works. If you're sweating or involved in water sports, you must reapply the sunscreen. In the newsroom, Mike Gilliam, Fox 5 News. Back to you, John and Rosanna.
Okay, thanks, Mike.